creative ways to increase our impact in Baltimore and work together with our neighbors to create a more just society for all. And I must admit, we have a long way to go. But our conversations like today. So thank you again for being here today for this important conversation and on investing in equitable access to education. So with that, I will now turn it back to Dr. Cooper. Thank you again for the opportunity to speak to you.
Thank you, Provost Kumar. So yesterday, we actually had a very exciting conversation focused on employment and health. And today, our conversation is going to be focused on the intersection between education and health. So Natalie, if you'll start the presentation, I can go over the highlights of today's program. So as you saw yesterday, I said we focused on employment, economic justice, and health, valuing essential work and essential workers. And today, our panel will be on the topic of education and health, paying it forward for learners and families, investing in equitable access to high quality education. We also have 2 more days where we will be covering other topics, food and health and housing and health. So we look forward to seeing you during those 2 days, and we welcome those of you who were with us here yesterday. Before we begin, I'd like to acknowledge the Indigenous and racial inequities that exist within our country. First, we acknowledge that Johns Hopkins University and our schools are on the traditional and contemporary lands of Indigenous peoples. Our campus is on unceded lands of the Piscataway and Susquehanna people. Today, there are more than 7,000 Indigenous peoples in Baltimore City, including members of the Piscataway, Lumbee, and Eastern Band Cherokee. We acknowledge the history of oppression and systemic inequities while representing all tribal nations' sovereignty. We strive to do our own work to address these inequities and disparities that Black, Latinx, Indigenous, and Native American persons, Asian Americans and Pacific Islanders, and other persons of color, members of religious minorities, LGBTQIA persons, persons with disabilities, and persons otherwise adversely affected by persistent poverty or inequality experience. So we're going to now go over some housekeeping items. This presentation is being recorded so that it may be later shared. We also have live captions that are being captured, auto-generated. We have a Q&A function, so please enter your questions for the presenters in the Q&A window only. Questions will be answered live or with short typed responses, and you can click the thumbs up button to bring popular questions up to the top of the window. The chat will be made available during the panel discussion for your reflections and open dialogue. To pose a question to the panelists, use the Q&A window only. We're also going to have graphic recording going on as a reflection tool. So we have a graphic recorder, Ms. Lauren Green, who is going to be capturing our key highlights during this presentation. We want you to also stay connected during the symposium. So you may tag us on Facebook, on Twitter, on Instagram, using the hashtag SDH 2021 whenever you communicate about the particular issues that we're discussing today. And remember to tag the speakers as well. So just a little bit about the Urban Health Institute for those of you who weren't with us yesterday. Our mission is to advance health and health equity in Baltimore by facilitating and recognizing collaborations between communities, universities, healthcare systems, government, and the private sector. We do all of this to build collective capacity for achieving health equity. We mobilize resources in support of promising strategies to achieve substantial gains in health and well-being of Baltimore residents. And that's largely through partnerships between academia and government. And then finally, we advance understanding, dialogue, and trust to create pathways for health, well-being, and social justice in Baltimore. We couldn't do any of this without this amazing team of leaders that supports all of our work. So their pictures are on this slide. They include our program director, Nancy Malello, Imani West, and Natalie Wiggins, who I want to extend a special thanks to, as well as to our associate directors. But in particular, I'd like to thank Dr. Rachel Thornton, who has really provided the leadership for this symposium in formulating the program and bringing together the panelists and the topics for discussion. So here's our outline for today. We've already started with our welcome and opening remarks by Provost Kumar. We had a musical performance beginning the program early on by a student whose name is Chingy Lin, who is a doctoral student in piano at Peabody Institute. And now we're going to have a performance by the Baltimore Children's Choir. And we talked about yesterday about the importance of arts and how arts are actually a way to give voice to the voiceless. They bring us together in community. And the arts are a universal language that we can all understand. They have healing properties, and we look forward to enjoying more of this during this restorative time. And then after that performance, we will go into our panel discussion, and you'll be introduced to our remarkable speakers and change agents. So without further ado, the Baltimore Children's Choir after the musical performance.
Hi, this is Chingy Lin, a student from Peabody Institute. The repertoire I'll be performing later will be selections from Schumann's Kreiseriana Opus 16. This composition represents a period of Schumann's life whereby he revealed his true personalities, such as Florestan and Itzebus. This music is particularly close to my heart every time I play, particularly in those slower movements. I can find myself sitting under the moon peacefully as Schumann revealed his true personalities. Unlike other meditation music, those meditation music keep repeating the same materials over and over again. In this composition, you can always discover something new while having the flow of that peaceful pace. I hope you enjoy the performance later. Thank you.
So
Bear with us.
there must be some sort of a technical glitch, but I think we're waiting for the performance by the Baltimore Children's Choir. Hopefully it'll be coming up soon because you don't want to hear me sing. I could play the piano for you though. Here we go.
One day when the glory comes, it'll be ours, it'll be ours. One day when the glory comes, it'll be ours, it'll be ours. Oh, one day when the war is won, we will be sure, we will be sure.
Hello, I'm Joseph Shortell, and I'm the Artistic Director of the Baltimore Children's Choir. We are so excited to be a part of the Social Determinants of Health Symposium, sponsored by the Johns Hopkins Urban Health Institute. The Baltimore Children's Choir is a nonprofit arts organization which works with over 500 students throughout the Baltimore region. This year, we currently have 2 neighborhood ensembles, one which rehearses in the Waverly neighborhood and one that rehearses in the Highlandtown neighborhood. We also partner with local schools to provide music education opportunities. The students sing a variety of songs ranging from classical music to multicultural folk songs to Broadway show tunes. Along the way, the students also learn lifelong music literacy skills. We will sing 2 selections for you today. The first is In Time of Silver Rain, with poetry by Langston Hughes and music by Canadian composer Sarah Shortell. This song will be sung by a small group of our singers, inside but masked. We'll then follow that up with a virtual choir performance of Lean on Me, which is mashed up with We Shall Overcome, arranged by Mark Hayes. If you would like to learn more about our organization, we do hope that you'll check out our website, which can be seen below on your screen. Thank you so much for inviting us to be a part of your symposium, and we hope you enjoy our selections.
In time
thank you so much to the Baltimore Children's Choir for that rousing performance, and as well to Chingy Lin for the beautiful piano music. It's taking me a moment to collect myself as a music lover and a lover of children. That was truly moving. My name is Rachel Thornton, and I'm an associate professor of pediatrics in the School of Medicine at Johns Hopkins and in the School of Public Health, as well as an associate director for the Urban Health Institute, and really privileged today to have the honor to serve as the moderator for our panel, Paying It Forward for Learners and Families, Investing in Equitable Access to High Quality Education Across the Life Course as a Health Intervention. And we are just thrilled and truly privileged to have the panel of experts and practitioners that we have for you today. I'm going to allow them to formally introduce themselves, but I will just kick it off with briefly giving you everyone's title, and then we'll have Dr. Santelises start us off with formal introductions, followed by Professor Johnson and Ms. Kalila Slater Harrington. Dr. Sonia Santelises is the CEO of the Baltimore City Public Schools. Professor Otis Johnson Jr. is the Bloomberg Distinguished Professor of Social Policy and STEM Equity in the Johns Hopkins School of Education and the Johns Hopkins Bloomberg School of Public Health. And Ms. Kalila Slater Harrington is the Chief Program Officer for the Family League. Dr. Santelises, please kick us off.
Well, first, I would like to say it is fabulous to be here with two folks I consider as colleagues, and thank you, Dr. Thornton, for getting us started today. I think that where we are currently as a nation, and particularly as the city of Baltimore, that this panel is particularly timely. So I want to thank you for having me. Can you just remind me how long do you want me to take for the first one so that I know?
We would just like each of you to introduce yourselves and tell all of our audience a little bit more about your work and your background. And then I'm hoping to get through about 6 or 7 questions, and also questions from the audience.
Just making sure, I don't want to take too long. So I actually received an email yesterday from City Schools congratulating me on my 5th year in this position. We do that. We do kind of work anniversaries. And so yesterday officially was my work anniversary of 5 years as CEO of Baltimore City Public Schools. Prior to that, had just about 3 wonderful years working with the Education Trust, which is a national advocacy organization specifically centered on education policy at both the federal and state level, as it impacts Black and Brown youth, as well as first-generation college goers. And prior to that, I was Chief Academic Officer in Baltimore City Public Schools. My 3 girls are full Baltimoreans, much to their New England sports fan parents' chagrin. So my husband and I, while we support them in their Baltimore rooting, we tend to go a little further north for our sports teams, but Baltimore is home for them. And I will say that prior to that, have worked in everything from some community-based organizations, as well as my work leading in Baltimore City. And I think the thread through my career, whether I'm in not-for-profit work, government sector, public work, or private, has really been this question of how do we make sure that all young people from every community have access to high quality education that isn't just high quality as kind of a lump term, but one that actually develops them in their gifts, their talents, and prepares them to give back to their community, so that when those of us who are much older on this call, I'll take great liberties, get ready to retire, we have a generation of young people who are ready to lead on past where we are. So it's great to be here with you all today.
Thank you so much, Professor Johnson.
Hello, good afternoon. Thank you so much for the invitation, for putting together a great introduction to our talk today. And it made me reflect on my own background and the fact that I'm from a low-income neighborhood and a product of public city schools. At some of those intersections that I just mentioned, neighborhood inequality, schooling, and then also policing. So moreover, I'm interested in social policies and how it impacts racialized populations, their opportunities, and then also their access to justice. So most recently, that work is kind of cohered around a couple of research projects. The first one is the fatal interactions with police study. And then also a set of studies funded by the National Science Foundation that ask, can we fill the STEM pipeline by draining the school to prison pipeline? That work has grounded my arrival here at Johns Hopkins. I began here in January. So I'm getting adjusted to Baltimore and loving it. And then also I've taken on the leadership role of executive director for the Center for Safe and Healthy Schools, where we've been committed and I don't want to say obsessed by, because I think it's important that we give attention to COVID, how it's impacted schooling, and what are we going to do to reopen schools safely. And then second, I will add that it's just one of two pandemics, and the other pandemic is structural and systemic racism. And so both of those need to be met with our coordinated voices, our coordinated assets, our shared vision for the sake of our kids, because it's the vulnerable populations, those that have less control, that we should be advocating for and giving voice to. So I'm really happy that I'm having that conversation with Dr. Santelises and Kalila Harrington, because I recognize them too as essential voices in the struggle. Thank you.
Why don't you close us out, Ms. Slater Harrington, and then we'll move on to our first round of questions. Thank you.
Good afternoon. And first, I would like just to thank the organizers for inviting me. I'm honored to participate, particularly alongside my esteemed colleagues. It's always good to be in this space with Dr. Santelises. I believe we've done some good work together. We continue to, and it's been an absolute pleasure to get to know Dr. Johnson. As was said, I'm Kalila Slater Harrington, Chief Program Officer for Family League of Baltimore. And I will share that I'm from Cincinnati. I'm proud of Ohio being the heart of it all. And it was for me. It's where I was raised and by activist parents. I had a father who was a sociology professor and organizer. So you can imagine some of my earliest activities, registering people to vote using our family's ironing board. I am the third of three daughters who our parents steeped in Black girl magic. And I am the proud mother of two Baltimore City school students and the very grateful wife of Pickett Slater Harrington. We've been in Baltimore for some time now and have fully committed here. I firmly believe that Providence has brought me to this position, and I have the great honor to work at a local management board. In our role, we really collaborate, we promote community solutions, we align resources, but probably most importantly, as a quasi-governmental entity, we have the ability and quite frankly, the responsibility to dismantle systems that have oppressed and been barriers to improved outcomes for families. And so I feel like I'm where I'm supposed to be, doing the work that needs to be done at this time. I was raised and still live by Martin Luther King's quote that a justice anywhere is a threat to justice everywhere. And I take that work with me every day. And I firmly understand the tension between systems and community, and have been doing this work throughout my career, whether it's been as an educator, middle school educator, if that gives you any idea, as a community school coordinator, director of programs, and on some of the groundwork of collective impact, and even in philanthropy. And so I have the unique and blessed position to have operated in many sectors, but always pushing forward as education as a key lever for social justice. And that is what brings me to you here, brings me to you today. And I'm so excited to get the conversation started.
Well, first of all, I am so glad that we made the choice to have you all introduce yourselves, because I feel like it is just wonderful to learn so much about the rich backgrounds and experiences beyond all the professional accolades that all of you carry forward into the work you do every day. So thank you for sharing with us a more intimate picture of who you are and how you came to be doing the work that you're doing. The first question that I think I want to kick us off with is something that some of you alluded to already in your opening remarks, which is really about COVID-19 and the way that it has thrust us into a new world and some really rapid fire decision making around education. And so I'd like to pose to all of you this question about what we have learned from the COVID-19 pandemic that could potentially help us innovate health and education as we go forward and as schools fully reopen. And I'm going to take the executive privilege here as moderator, maybe to have Dr. Santalisa start us off with this one, because I'm sure she's living every day just the operational challenges of navigating what has been thrust upon us in the past year.
Absolutely, Dr. Thornton, and I will say now, I'm sure I won't cover everything because it really has been just a whirlwind over the past probably 15, 16 months now. And but I will say, I do think that there are emerging lessons and lessons that bear heavily on the potential for schooling generally and schooling within city schools to actually move to a level where we're better accommodating the needs of families and students, and then in turn, better educating students. And I think that one of those has been the front and center role that families have had to play in the education of their children. It has always been the case that families have been, partners, and we would talk about it a lot. Educators, and educationees, had all kinds of, ways of talking about the role of families. But that March, when school got closed for the first time in terms of physical space, the need for educators and families to partner together for the education of the city's children really was almost in a crucible-like state. And I think some of the things that we've learned from that time is, one, I've had many educators say to me, very, kind of nondescriptly, that this was the time for them to see a different side of their students' lives, right? We were in people's kitchens and living rooms, and grandparents and uncles were peering over students' shoulders to say what's going on. I mean, my sister is a college professor, and she was even chuckling and saying, let me tell you, families wanted to know where all their money was going, and they were sitting and listening on my class. So I know they were listening in on your class. And I think that brings and has really bubbled up with a new level of agency for a number of families who now have visibility into what that teaching and learning relationship looks like. And I think if we leverage that positively, it can help propel schooling. If we don't, and I've been real clear on that, and it was interesting because I was talking with a group of parents in the Nashville area who've done a great job in mobilizing around what the profiles for their students will now look like, beyond just what we in education know as CUME folders, but to be a far more collaborative process between families and schools in kind of a whole approach to young people that I think is a great example of what came. I think the other piece is just knowing that the flexibility of what we previously had in place and thought of as being fixed and immobile has just been blown out of the water. So notions of time, notions of space, notions of who teaches, right? So even that question, we had bus monitors who were supervising, students on distance learning, who were also taking young people aside to help with some one-on-one. We now have a cohort of tutors who are from Baltimore City, many of whom were educated in Baltimore City, who are able to come around and support our young people in ways that we had not seen at scale before. So I think that, what we do with distance learning, there's a bunch of things that I think we're learning, but this idea of kind of the fixed notion of what is school is, I think, really been the pressure point that I've experienced over the last 15 months.
Any others want to add to that before we move on? The
Sure.
chat, the Q&A is also very active, and we will do our best to get to everything we see.
Well, I'll just add a few things. I mean, what Dr. Santelises is mentioning really gets to one of the first things that I noticed as a former board member of the school system until recently, that families and youth are resilient. I mean, we really did transport education from an institution into people's kitchens and dining rooms and family rooms. So that's their ability to manage that transition as hastily as it was done, and then make the best of it. Really, it shouldn't go unnoticed. But at the same time, we also noticed that a lot of inequities in the social determinants of education and health were made more visible, more pronounced because of COVID. Maybe before we didn't know much about the digital divide, differences in access to internet service and internet providers and the actual technology. That's one thing that our school system had to immediately respond to. Then the food insecurity, the fact that kids relied on those meals, school lunches. Perhaps again, more than we thought. I mean, of course, we knew that free and reduced lunch and free breakfast programs were in place for kids. But at the same time, now we had a better sense of what might happen during the summer when school is not in session, and what might happen during the weekend. And coupled with that, we had the challenge with transportation. Families oftentimes couldn't get to the food that we were making available to them, even though we didn't have kids on school grounds. And then the last thing I want to mention that I think really is important is housing insecurity. fact that the pandemic made a lot of people's rents and mortgages behind, that then impacted their ability to stay in their house. All of these things, I believe, probably put tremendous stress on those families at the same time that schools were requiring more of them in terms of their kids' education. The other thing that I think I should say is that, yes, we learned a lot, but I'm kind of saddened that we didn't learn more because we lacked national coordination and leadership about how to handle the pandemic and what we should be observing and how we should be observing these changes in real time. So I'm sure those eyes on the ground can inform the policy agenda. But in terms of any type of continuity that's going to really address equity and racial injustice, we're kind of blind to that. We just don't know how prepared kids are going to come back to school when they reopen. And then the last thing is the teaching workforce. I have to mention, again, their strength in first doing in-person instruction, then all of a sudden being expected to deliver distance or hybrid learning experiences for kids, and at times doing both, right? Doing hybrid learning and doing in-person instruction for those kids, at least in our school system that required special education or bilingual educational resources. So that was tremendous on their part. But I also want to say that it exposed some fragility in some ways in which we can better support our teachers, their social emotional well-being throughout this time, their professional commitment and connectedness, and their professional development to reduce the stress and to increase self-efficacy about, their job and their identity as teachers. So I think all of those things are key lessons to be learned or lessons that we have yet to learn, and then implement some type of I guess, secure some type of benefit from what all collectively experienced.
I'll just jump in here as well. I would echo what my colleagues have said, particularly Dr. Santelises around we have evidence now that we can depart from what traditional education has looked like. And a traditional education that in its pre-pandemic did not serve all children. But then you have the compounded issue of race, the compounded issue of the pandemic that has caused us to really kind of figure out a different way. And I will also say that nationally, we've endured a trauma. And it's caused us to have real conversations, I think, in ways that we haven't previously around trauma, around mental health, and around student engagement. Our young people have been enduring all of this and have shown up to class sometimes without cameras on, and really having to have those conversations around, I'm not well today, in ways that might not be possible when you're passing classes, or an educator who has to figure out how to really engage students in a different way. And so I think that we now have the evidence to say it doesn't have to look like it always looked. And we have the right to say that it didn't serve us in its original form anyway. That there were great inequities. And so we have every reason and opportunity to change. And I'm grateful to see some of the things that Dr. Santelises and the district and other districts are putting into place, but also this real reckoning around race and how everyone is being served, the digital divide. I think it's an opportunity. It's been a very difficult time, but I'm looking forward to what happens differently moving forward and how we are all coping and meeting each other in our humanity around mental health.
Well, frankly, I couldn't have set it up better then that lead into what really were the next kind of paired questions that I wanted to make sure we touched on, which have to do both with the emotional and mental health and social well-being of students, and also the deep work still ahead around addressing systemic racism. So I'll pose them as a pair, and please take them as you will, which is really how can schools in Baltimore, and I think we have people from national organizations and around the country as well, so lessons learned from Baltimore, but how can schools really address the social and emotional health of youth as we move forward, particularly considering the trauma that many may have experienced in a multitude of forms during these unusual and difficult times. And in addition to that, what is the work ahead in Baltimore schools, but in schools generally, and how are schools really positioned to work around issues of systemic racism as they relate to education? And I'd just like for everyone to reflect on the components of those questions that most resonate with you today. But I think it's just a really important topic that's been brought up, the multitude of things descending on children, descending on their families in these difficult times.
So one of the things that I would say is that one, with regards to particularly mental health and trauma, I think one of the things that we have seen that is informing how we plan, our work, which we are calling, re-engage, reconnect, and reimagine, right? So instead of saying recovery, really, how do we take all three, right, and blend those in, is that one, young people enter from very different on-ramps for mental health. There are those young people who we saw, for example, really benefited from having mental health professionals engaged in telemedicine, right? So just the expansion of telemedicine made it easier for young people who might have to wait 2 or 3 weeks for a psychologist to circle back in their school, could more readily, access actual professional mental health care. I think some comes from just, and I think some of this has come up in some of the questions in terms of trauma-informed care, right? And what that means in terms of the readiness of professionals. And that's everybody from my seat to teachers to custodians, to be able to recognize those signs of young people in spaces that don't come in, with a sign on their chest saying, hi, by the way, this is my point of trauma, right? Like, you've got to be able to recognize the signs and be able to differentiate. On the other hand, I would also say I get concerned when discussions of trauma actually help reinforce the broken Black and brown child narrative. And I just want to say that explicitly, that if it only is grounded in how broken kids are and not how we use their talents and gifts to help them learn and access healing, then it actually is not going to get us very far. Then they go from just being broken academically to now being broken socially and emotionally. And so one of the things we have heard from young people is that the spaces, and again, a number of folks talked about this in the Q&A, spaces for art. Like, art becomes incredibly important in this kind of new post, 2020 world. And I think Otis said it beautifully in that, look, this has been a melting pot of issues. Kalila talked about that as well. And so that health, what we're seeing is young people expressing themselves in ways that are healing, in communities that are healing, when they have access to art, when their families are attended to. And our community school coordinators, as far as I'm concerned, are some of the unsung heroes from the last 16 months, because they have been that intersection in connecting things like housing, substance abuse, and just everything from that to, do you have access to the internet? They've been the intersection to kind of help connect and actually create healing communities. So what I want to make sure is that we don't overly prescribe clinical interventions, right? Again, and I'm just being real, to Black and Brown children, when really if we would have supportive cultures, right, in schools, that in and of itself is a healing experience. And so, and I will do a shout out to our Be More Me youth exposition that's coming out, and the leadership of teachers. The Be More Me curriculum was developed to not just say, kind of where is racism in our society, but to also lift up the strengths of communities. Because again, if racism is only, a discussion of racism is only giving somebody else, and let's just be straight, a chance to weaponize and tell me how horrible my life has been, that does not give me, it has to name what the transgression is, as we do with our equity work, but it also has to lead me to the strengths of our community. And what we have seen in our young people through the Be More Me work is that when the classroom gets expanded from who I'm learning about to how I now view my community, not through just the lens of the other, right? Through the 20-second clip that gets circled around the globe of, a CVS store, is not the story of my community. And so what Be More Me has done is allowed our young people through curricular experiences connected to leaders from their community. It's different when I get to sit down with Devin Allen. It's different when I see Erica Green on a panel, and frankly, people like Mama B, who just are out in the community connecting with kids. What we are finding is that has what I would call a protective coding for young people to actually have something to refute some of the hegemonic larger narrative that says they are not worthy or they are permanently broken. So I am very much a both and person, not an either or. We got to do both. We got to name what's real. We got to name what has occurred, but we also have to be sure that we are grounding it in a community healing process. And I feel really strongly, because if we are not careful, we are going to turn a trauma exercise into a victimization exercise. And I think that we have to be able to name it and provide those spaces without leaving young people feeling even greater despair than they were when they were entering from truly traumatic situations.
Thank you for that response. There's a lot in there, and I think that this conversation needs to be had, because as someone who is a childhood abuse survivor, I do understand the need for these services within schools and a perspective that supports meeting children where they are and providing the resources that are needed. And yes, that could be victimizing in a way, to the extent that there aren't other ways in which we can facilitate their coping. And for me, of course, music was a way kind of for me to escape everything, go into my piano practice room, and just be musical, right? But I also want to suggest that there are two other things we should think about. One is that children are both fragile and resilient, right? Simultaneously. And just to give an example of this, I think about 40% of our children now come from two-parent households, and then about half of them will experience divorce. So I think divorce is a pretty traumatic event for kids. And yes, they do bounce back, but that's a significant portion of kids within public schools that are just dealing with that eventuality, likelihood within their 14 years. And we're not even adding on the other ways in which they might experience life differently. So yes, trauma is real, it's happening, and it's fairly prevalent enough for us to have a pretty robust systemic response for it, without victimizing kids, because we also understand that they're resilient, but they need that support, that care, and ways to cope with that trauma. The second thing I want to mention, and this actually is in line with what Dr. Santalisa says, I too am concerned with pharmacological control and medicated control, really, of kids within educational spaces, that we, because of trauma or for something else, we give pills, we give special education assignment, and while some of these resources are necessary, we also have to be sensitive to the racial imbalances that we know are evident or prevalent within these approaches to children's well-being. And the last thing I'll mention here is that a lot of this needs to be located within schools and school reform, and not so much of what's wrong with our kids and let's fix it. For example, as we think about schools reopening, there are going to be some bumps in the actual social system that extends from the school's obligation to understand where kids are in their learning, but then also to align that with where they should be in terms of proficiency, and then also with the curriculum. So it's there where kids might experience some frustration when they come back to school, because we really don't know where they are, right? We don't know how much they've learned or how much haven't they learned within home settings. And then they come back to a school system that's rooted in a bunch of assumptions about how to align curriculum to learning. That's going to lead to frustration. And that's not an obligation of our kids to fix. That's an obligation of our schools to fix. So at that point, we should be stepping back and saying, perhaps the hyperactivity is from the fact that our curriculum is just not aligned with where kids are. Right? Instead of assigning them to special education, giving them IEPs and medicating them, let's think about how we need to change and move forward given the circumstances.
And just one thing maybe to pick up on that I saw come in the chat that just resonated with me as a pediatrician is anecdotally, is there's one question or comment about a child with attention deficit disorder, ADHD, and I have certainly heard similar things from some of my own patients' parents, that they've observed a greater ability for their children to kind of engage virtually and been concerned about going back to school. Just as one example, perhaps that if anyone wants to comment on some of these topics that Professor Johnson alluded to around the nature of expectations of educational settings and how those might relate to, really the developmental and sort of the specific needs for certain children. I don't know if anyone wants to comment on that. And then I think there's another question in the chat that I'm going to tie to our next question as a panel.
I'd like to jump in here. Particularly, I'm a parent of a child who has special needs. He has autism. And so this has been a really trying time in terms of his level of engagement virtually. And I absolutely appreciate the sentiment that it may not be him. It is incumbent upon us. If they didn't learn, we didn't teach it. So let's figure out how we can teach it. And that's at least the school of thought that I came up through education with. But I also wanted to, I just totally lost my thought. I'll turn it over to another panelist because my thought just totally went out of my head because he's over there. My son is.
Well, if your thought comes back, Kalila, we give bonus points for mommy distraction. So that's a good thing. Now, I would just say we are, Rachel, hearing this over and over again from some parents, and some for whom virtual just did not work. at all. And it's part of why we made the push to have some in person, because we knew virtual wasn't working for everyone. On the flip side, I have received similar emails from families saying, actually, my child is engaging more now. My child is actually learning more now. And I think part of what this signals for us is that this mass investment in technology that was unprecedented for Baltimore City. Let me just say that we went from having one device for every 4 students to just about 1-to-1 right now. And so what it's doing is it is pushing us for that next level, first of teacher support. And teachers are telling us, I can differentiate more effectively now, right? For a student that is either in a different place academically or is in a different place with regard to their learning, right? That their learning entry point. So really the push for us, part of the push we're giving ourselves is how do we make sure that this investment, one in technology, is being leveraged moving forward, that it's not seen as just an emergency intervention, but now another tool that we can take advantage of. And 2, it's going to have real serious impact on what the schooling options are for public school families in Baltimore City moving forward. So we're talking about, a virtual school moving forward. Is that something that some families will continue to want access to? Using more virtual coursework, right? We found with a number of our incarcerated students that the virtual realm gave them the opportunity to take coursework at University of Baltimore. And so that worked well too. So I think part of what we're trying to do now is actually, as a public school system, think of what are the options we can actually provide for families, but then how do we, to I think a point, Dr. Johnson made earlier, how do we also support teachers in their use of this new technology to address some of those issues? So that's 1 or 2 things, but I have heard that. And I have a number of teachers who sent me emails saying, I know virtual didn't work for like 60% of the kids, but I gotta tell you, these 10 really soared during this time. And so we're going to have to, I think, support teachers in the use and also provide more options for families.
Well, I want to pick up on this thread. I see it coming through in the chat as well as in one of the questions we actually had planned, and tying in with one of the questions we also received in the Q&A. And it's this idea that certainly it takes a village in the full, actualization of the potential of our young people and our children, and really that education is only a part of that village. And would love to hear your thoughts and reactions in terms of how we situate education in a web of structures and systems in Baltimore. And certainly I think there are some who would love to hear you extrapolate beyond Baltimore, but in Baltimore to support youth and their families. And I think this relates really to a concept that came out that really was the underpinning of this whole series we're having this week, which is this idea about working across some of the sectoral silos or across some of the different services and entities that serve our young people and our families. Could you all speak to what some of the key ingredients are for this in the work locally in Baltimore, and then also for those with a national lens, thinking about what the national conversation and action should be in this area?
Funding is not always the answer. It's not, but it's certainly a significant part of it. And I think that what the pandemic has taught us is, one, our schools were already underfunded, but that additional funding is needed. And that can be realized, and efficiencies can be realized when our systems partners are working together. Our families attend school have to be housed. They do. And while we do have some examples and evidence that systems partners can work together effectively, there has to be a reckoning that it's not always the case, and that we need to fund what is working, and systems partners being, and really leadership being really ready to seed some things in order to make schools more effective. And so this means that we really do have we take a look at our police departments. We take a look at all of those things. And so I would think that one of the levers would have to be budgeting and how we finance schools, having real authentic looks at what our systems partners' budgets are and putting our investment where we know that it needs to be for our children and families. I would also say that here in Baltimore, we have a really effective and wonderful nonprofit sector that is built around schools. Our community school lead agencies and partners, to Dr. Santelisa's point, really stood in the gap for those families who were not reachable in the beginning, making sure that families were food secure, and then even in instances where we had immigrant families who were skeptical and had some ambivalence around coming to any government structure to receive food. So it is a leveraging of multiple systems in order to be able to realize some change and to really not only meet the safety net layers of services, but also getting to the systemic issues.
I think Kalila just hit it on the head there. I'd like to think about this as an ecosystem of care. Unfortunately, there's also an ecosystem of risk, but definitely there needs to be an ecosystem of care and the supports, the ways in which kids deal and negotiate with all that's going on. And just one example, I think we have to look, of course, the current climate and the George Floyd, Breonna Taylor, and others that have created this something that just can't be located within one institution, right? It's pervasive. It's the way in which they can actually view the world in ways that structure harm at every turn. And I think that is a source of racial stress. It's a source of anger. It's definitely a source of I guess, hopelessness that some kids might feel when they see that happening and it happening so frequently. So it's going to take a village, definitely. Schools are part of that, but let's think about policing in Philadelphia, for example. It was the Philadelphia Police Department that decided that they were having too many arrests coming from schools. And they're not the only city. There's great data out there about San Bernardino that from 2005 to 2014, they arrested 7,000 kids on the streets, but they arrested over 30,000 in the schools. So we're actually at this point where a lot of people who are connected to the justice system are first introduced to it via schools. But Philly, what they did was they decided, we're not going to wait on the schools to make the change, and the schools can't make all the change. There needs to be shared responsibility for our youth and their well-being. But there they decided that they would, I guess, implement some type of restorative justice from the police agency. And so they got to know those kids and try to understand their infractions. And sure enough, the first year they decreased referrals by 60%. And the next year they decreased referrals by an additional 40%. So here schools might be outsourcing and their punishment and discipline to school agencies, or there may be SROs there that actually provide some social support and order. So I'm not demonizing them, but I am saying that they too should be responsible for reform as a key partner with schools to make sure our kids are not criminalized, experience adultification, and being racialized. And so I think that's just one way in which, one example that supports this village concept, and the fact that it's going to take change along all of those dimensions of the ecosystems for kids to feel that type of wraparound care that I think is essential to their well-being.
You know, and Professor Johnson, you actually just hit on a question I was reserving for later in the chat, which was really about this issue of punitive systems associated with schools and what some of the strategies might be to transform that. So, you know, we may have time to come back to that for further discussion as well, because I think it is a critical point that certainly there seems to be a lot of interest in the audience about. I did want to just switch gears a little bit because I think the other thing that's come up in some of the answers thus far, and maybe selfishly as a parent as well, navigating this world that we're in, is the multi-generational component of care that we're talking about here. And I would love for each of you to kind of speak about what some of the multi-generational educational programs and supports, whether it's within the school setting or frankly, even as we're thinking about these cross-sectoral collaboration, both to support the children, but also to support parents and other adults who are really another essential ingredient in the lives of our children and their success. Just any reflections, any thoughts, any perspectives from where you sit in terms of how we are currently positioned to address multi-generational needs that further support children and where we might go and what we have learned from this experience.
So and I'll just give one or two examples, and I think it gets to, you know, Dr. Johnson's recent reference to an ecosystem of care, which I love. I hear ecosystem, but I like ecosystem of care a lot. So I'm going to quote you on that, Dr. Johnson. But I do think that one of the things that we saw, and I noted some of this in the chat, and I know Kalila through her work with the Family League sees this, that we still have siloed public policy that eschews and oftentimes will impede the ability to approach families in a multi-generational and whole societal unit way, right? And one of the biggest examples of that I think we saw success in the city of Baltimore, it wasn't just city schools, but the city of Baltimore came around this idea of food security and food insecurity. From March through present day, and I will tell you in that first, 3 to 4 months, I was not worrying about kids' calculus packets nearly as much as I was worried about young people being able to eat. Well, what we found in our work from our lens in city schools was that it's not just about children eating, it's about grandparents eating, right? It's about parents eating. It's about adults, right, who care for children eating. And so what we saw, I thought, was a great example of how from a policy lens, we've got to begin to just name where things are, frankly, too sectioned off. So you have the school feeding program, which is separate from the senior feeding program, right? Which is separate from, the USDA kind of support of families through food stamps and other things, right? That now, frankly, what we're seeing was that families were receiving cards that actually allowed them to combine what their the cost of their students' school-based meals to actually then support a whole family's access, right, to having their own food, right? And so we started out at first, and I remember the call for the decision of, Sonia, we only get reimbursed for school meals that we give. And those were like in the first 2 or 3 weeks where we didn't know where the food was coming from. And they said, well, we only get reimbursed for the meals that we give to students. And I said, I don't care if you think a grandmother who has walked 5 blocks to get her grandchildren, this was real story. I'm standing there with the food and nutrition worker, right, looking at me like, okay, boss, like, what do you want us to do? And there's no way we're not going to feed grandma. We're not going to give grandma food while we're handing it out to kids. And so what it did was it pushed the city to more nimbly, I think more efficiently. We transitioned from take-home food for everybody to now having boxes of food. We partnered with outside organizations in addition to city agencies. So I think if we approach this as the family is the nucleus, however you define family, the family is the nucleus. And then, right, young people are part of that nucleus. And so one of the things we're doing now based on this is with our literacy. We've been working on literacy for a couple of years now. And one of the things coming out of coming into this quote recovery period that we're thinking about is how do we have community-based literacy centers that are far richer than just changing the curriculum in schools, which we've done, right? But how do we actually bring a larger band of community around what it means to have young people who are fully literate, right? And then connect that to the kindergarten mom who I met yesterday in a school. I was at Samuel College Taylor and she was asking about the kindergarten graduation. And I got a chance to meet her and she said to the principal, now principal, right? I think I want to get my GED now, right? And, y'all need to help me figure out how to do that because you're the school people. And so from mom's perspective, she was coming to the educational institution she had access to and wanting the connection to what she saw as important. There was no convincing. You didn't have to convince her, oh, literacy is important for your child. She already knew that, but how are we creating experiences for that multi-generational connection to take place? So everything from food, security to literacy, for me, we have new opportunities, but we've got to be willing to break down the policy space. We've got to stop the siloed funding and the siloed practice. Sorry, that was long.
I kind of want to say hallelujah, but please, let's.
But I wanted to just jump in here and agree with Dr. Santelises and say across the education spectrum, one of the investments that I'm most excited about that Family League is engaged in is really a HIPPY program. And HIPPY is an evidence-based home visiting program. But here in Baltimore, we were very clear and our partners were very clear that this could not just be anyone coming into homes, right? That we needed to reweave the fabric of community. And so these are moms going to educate other moms in a peer model about kindergarten readiness. And we knew that it was not just important to reweave that fabric of community between moms talking to moms, but also workforce development. And so now you have young people who are benefiting from staying home, benefiting from getting kindergarten readiness skills from their first teacher, but also moms who are employed now and who have skills. And they may very well be that same mom who approached Dr. Santelises, who now have an inclination to get their GED and have a career trajectory. And so I think that we have evidence that 2-generational approaches work, whether it be in our community schools where we have high schools where parents are coming up to get services, where parents are the ones leading the food distribution. And so we know that it works. We know that children do better when their parents are stable. We know we've got to do some work around income and guaranteed income and making sure that families can thrive. But we've got to be able to have that broad focus, as you suggested, on not just kids, but addressing the whole unit.
this is wonderful. And I think we're going to pick up on this thread further, because I do see a fair amount of things in the chat, that in the Q&A, that we can weave together. I wanted to shift gears just a little bit to, and this is kind of picking up on something that Professor Johnson said early on here, which is kind of looking at children as both fragile and resilient, and thinking about them also as just an amazing source of leadership. I mean, I'm a softie. I was brought to tears watching those children stand at a distance with their masks on and still sing beautifully, watching them adapt with their headphones in their rooms, singing together virtually. When we think of our children as the future, which I certainly do, and I hope everyone does, although sometimes I do wonder if all of our policymakers see them that way. What do you think they have shown us, and how have they really led the way for a future that really gets us closer, helps us make additional strides towards equity and equality?
I can jump in here. Yes, children, at least the ones that, I mean, everywhere, they've been dealing with this, but my personal observation has been the ones that I've worked with in St. Louis. And so there, it was clear from the beginning that kids were going to have to put up with a lot of unknowns and a lot of systemic change that at times was, really not thought out. I'm not going to say not in their best interest, because it, best intentions, but of course, we just were unprepared. This was just new ground for us. And really what our kids have done is that many of them have prevailed anyway, excelled in ways that we didn't anticipate. And so they are actually presenting us the lessons learned. And I think I can say this because the Center for Safe and Healthy Schools has been working with Dr. Santelisa's team to try to understand what are those bits of wisdom that our kids are sharing with us in their success. And I think it's there that we're actually going to find some of the innovations that can be sustained, that can help us transform systems. And, it's also an opportunity for us to, well, I guess we have kind of peered into their lives, as they're working virtually from their own kitchen table. But I think it's presented an opportunity for us to learn more about what supports families, what families can use, and in order for them to be more, I guess, resourceful partners within the educational enterprise, or at least acknowledged and recognized as such by educators. So those are just a few things that I think the kids have really shown us. I'm sure that's the same here in Baltimore with Dr. Santelisa. I'm sure she can speak to that as well, but it definitely was the case in St. Louis.
No, I would add that, I do think that the constant push that young people have done, frankly, before, March 2020 or April 2020, really did propel forward, and is that strength of advocating and reminding us that their voice has to be in the table. And really, we're very thankful, because sometimes as a large behemoth organization, it's easy to think you're listening. And I think that's where community partners have been incredibly valuable, because, there are organizations, community-based organizations, that do a far better job in youth development than schools do. And so instead of kind of pretending that schools are bastions of youth development, a a lot of times it's our community partners that keep us honest. And I think and what I love about young people and young people in Baltimore is they keep us honest. If they think we're off on something, they will say. I will also, again, highlight the work around the Be More Me curriculum, because it is young people who have taken that and said, and I remember two of the young women working on the first exhibition that was supposed to occur last May, but you know, had to move virtually because of the health emergency. And you know, I remember what they looked like, sounded like, and the questions that they asked as they were planning something for their peers, right? That had distinctly their voice in it. And they have a way, young people have a way of really showing up the distance between how those of us from a different generation think a learning experience is supposed to go versus what they deem a learning experience. And so I have appreciated, and it hasn't meant that I agree with, you know, different groups on everything, but I have appreciated their insistence that they be at the table, that their voices are heard. And when we open up, and we've gotten better about it, we're not where we need to be, they definitely bring the creativity, the on the ground knowledge, and the truth telling that you often don't get if you're only talking, you know, to other adults in the system.
This is great. I'm watching the time whittle away and trying to see how we can get it to as many of these additional topics that we have on our list. Just picking up and maybe closing out on this thread of the partnerships between community organization, other institutions within the city, and schools. Is there anything else that the panelists would like to add to expand on this idea of what it is that service providers, CBOs, academic institutions, and others in the community could further do to support our schools and their work, but I think more fundamentally here to support our young people and to support kind of realizing our goals around equity and elimination of disparities in our communities. Any further comments on lifting up our partners in this work?
I'll use a phrase from my collective impact days that, you know, we have collective responsibility and differentiated accountability. And that means that we all have responsibility for our schools and the families and students. And, you know, I had an experience in Cincinnati where I was working with the district and it really coming up, having some challenges. And the then superintendent said, you know, you all don't have any skin in the game. You all post our data, you tell our stories, but you don't have any skin in the game. And what I would just give emphasis to in this segment is the importance of partnerships and the importance of everyone seeing their responsibility with our schools and with our families. And that if our schools are not successful, then we all haven't been successful. And that it is all of our responsibility, and that schools really need partners. They need partners to do the on-ground work. And to Dr. Santelisa's point, our consumers, our families who consume need to have a say, and a real say in what this looks like. Our students know what they need, and very readily, particularly when it was talk about going back to school, they had everything to say about what it needed to look like and on what grounds they needed to go. And so I think that there is a lot for us to learn from each of our members of society and our partners to really make sure that we are doing something differently and really seizing this opportunity.
The one thing that I would add, I guess it's the combination of the last question and the current one, But another thing that our youth did was really organize us, gather us, radicalize us in some ways around racial justice and policing. They were the ones that organized, they were the ones that protested. And not saying that we also didn't join them, but it was a radical energy that I think they had, that I think we should have about our city schools. And I think our partners and all of those who can impact change, can leverage resources and their power to bring about the type of educational and health environment for our kids that's best for our kids, really need to rally around in a way that meets the moment. I mean, this post-COVID moment it's here. It's serious. It's going to have consequences for a group of cohort of us for generations, right? It is so. I think that type of radical energy that was demonstrated in all of these Black Lives Matter protests and all those who were concerned about racial justice, this is that moment for more racial justice and more galvanizing around the issues that are important to our communities. So I think that can't be overstated, that if we don't organize and push and get ready for the post-COVID moment, then there are going to be costs associated with that. And I fear that they're going to be really high costs.
I'm going to try and do my best to squeeze in two more rapid fire questions. And one I think is really critical because we want this to be a platform, a springboard for action, for advocacy for those who are tuned in. And there is a question that really asks every one of our panelists, our experts here, if there is a pending policy that you would raise up that you believe is critical to advance, to help us make and maintain strides in the work to support our children and our families through this moment with respect to education or with respect to what education requires of us as a society.
Well, the one that I would throw out there is the one I've been, I guess, preaching about in my research for the last 3 years, is that we need to decarcerate schools. And the best way to bring about a healthy and safe school is to focus on getting kids emotionally connected, feeling loved, affirmed, being connected, sense of belongingness, self-efficacy. The mental health component of school attachment is huge. That's what makes a school safe, at least from internal threats. So not that I'm saying we need to get rid of SROs, but I do know where we need resources and what the objective should be so that we do not need SROs. And so that's just one big change that I think really extends from the fact that the criminalization of Black and Brown youth, or the criminalization of Black and Brown bodies, is not just for adults, it's for kids as well. And it creates an educational structure and systemic racism that impacts not only those that are suspended or those that are expelled or arrested, but it actually brings down the performance and college entry rates for all of those kids in schools that rely heavily on those technologies. They're moving AI into these schools now with facial recognition software. And if we don't stop this path, we really will make schools feel like prisons. And so that's one thing that I think we need to connect to health, because we can't have healthy individuals and support their health while at the same time we're criminalizing them and being suspicious, as if we're at risk because of their presence.
Dr. Santelises, I think you touched on another one in the chat, which was specifically around more access to the arts for students and some of the ways that investments in those areas, both to the earlier points around healing, but also the need to kind of invest in those as important programs within schools. I don't know if you wanted to say anything further about that, or if there are any other policies. And I just want to thank Professor Johnson for that answer. I think it gives us a lot to really think about and visualize as we come close to the conclusion of today.
Yeah, I think one of the things that I would highlight is really connected to this idea of healing spaces and safe and nurturing spaces. And I think art is part of it. I think it directly thwarts the continual flow of young people through disciplinary pipelines that lead to incarceration and alienation. And because what I have found is that our schools with the most cohesive, nurturing school cultures remained the most cohesive, nurturing school cultures. And I think Dr. Johnson has heard me say this before. Those that fit that description before the pandemic were that way in the pandemic. And so this notion that the pandemic, multiple, right, racial pandemic, health pandemic, came in and just turned everything upside down, I think it's more true that it was a crucible. It was a heated, intense environment that actually showed what was underneath the surface all along. And so I think part of the real focus in policy building is policies that help meet the needs, right, of young people to be part of a culture and a community that then allows them, or I should say simultaneously allows them to access the kind of opportunity we want them to have. And you need opportunity-rich environments. So you need environments that have the kind of coursework, as bare bones as it might sound, not all coursework 5 years ago was available in all schools. And we still have a ways to go with that. Not all schools had the arts programming that they should have had, right? Not all schools had with our CTE programs, right? We heard from our young people, particularly those that were most pushed out from the current schooling experience. Their piece was, look, you gotta connect my schooling with what I believe I want my life to be after this. And some part of that is work. And so when we looked at where our career programs were, they weren't in certain schools and they were in others. So I think it's a combination of, again, beginning with these cohesive and nurturing school cultures and making sure that that is not the end, right? Like, I nurture my children, I care for my children so that then they feel grounded enough to go out into the world and, let their gifts impact the world positively. People ask me all the time, how can you take the shot you do as a CEO? Mm-hmm. Well, let me tell you, because I have grounding, nurturing relationships. If I was looking at all the people in the press to, make me feel like a whole person, I'd be in trouble. It's the anchoring in nurturing relationships, as Dr. Johnson talked about, and I think Kalila noted kind of the community activist part of this is that this is community work. School work is community work. We just need to shift our policies to reflect that.
And I could not think of a better note for us to end on today, while it's the end of today, it's the beginning, I think, of much more work ahead. And I just want to thank all of our panelists, Dr. Santelises, Professor Johnson, Ms. Slater, Harrington for a dynamic and very engaging panel. I'm going to turn it over to Lauren from Dancing with Markers to do a graphic representation of today's conversation, and then we'll pass the baton to Dr. Cooper thereafter. Thank you again to everyone for this dynamic and engaging conversation.
I'm just going to do a quick test of this video, and it should look like a time lapse. So Dr. Thornton, be my test and give me a thumbs up if this looks like a time lapse to you or if it looks choppy. It looks like a time lapse. Okay, I'm gonna let it play. It's gonna just take about a minute and a half. So this was captured live during the conversation. And as you take a look at the video here, and I know some of it may be a little bit small, so don't worry, you will have a chance to see the zoomed in version later, but just think back on the conversation today and go ahead and type in the chat, not the Q&A, but the chat. What is one key takeaway that you're going to carry forward with from this conversation? What is one key takeaway you're going to carry forward from this conversation? And I see one already from Karen. Thank you. Accountability, safety, advocacy at the community and government level. Thank you, Karen. That's excellent. And I'll keep looking at the chat for others. The change in ecosystem of care in schools. You need partnerships between parents, community, and educators. Yes, that was very clear. Yeah. What else? Ecosystems, yes. And now hopefully you're seeing the pan and scan going across of the final, yes, health of the family unit. Thank you, Ash. Public schools should be used as one-step community centers for getting resources and information out to community members. Yes, I think ecosystem was, I believe that was Dr. Johnson's verbiage there, and that seems to be coming up very clear in the chat. So continue to post your themes into the chat, and we'll be sure that this goes out so that you have this visual summary. And with that, I'll pass it back over to Dr. Cooper to take us to the next place for this afternoon.
Thank you. Thank you so much, Lauren Green from Dancing with Markers. That was a beautiful visual representation of such a rich discussion we had today, wonderfully moderated by Dr. Thornton. And I just want to thank you, Dr. Thornton, as well as our excellent panelists, Dr. Otis Johnson, Dr. Sonia Santalisa, and Ms. Kalila Slater Harrington. So I don't know if I can say it any better than it's already been said, but I certainly learned a lot and of course feel so inspired. There are so many lessons that actually I think resonate with some of the things we heard yesterday about community and about shared accountability. But I mean, I think I heard so many things about also the importance of the richness of education for life-term development for children, about the important role of the arts and exposure to other opportunities within the school environment, about how we actually deal head on with the tensions between systems and community, how we focus on the important role of families and in supporting and uplifting them, engaging our students and using a strengths-based approach, creating nurturing and supportive environments for them. Really, that this is a time for a radical approach and that we need to decriminalize our approaches and deracialize them and actually create these, again, safe and nurturing environments for our children where we can actually, they can serve as a point, you know, along with our partnerships that we have with our other community partners and sectors, basically to really focus on not only that child or that learner, but also that entire family that is the nucleus, right, that we need to support. So I know I'm inspired and I've come away with so many thoughts and ideas for how I can build partnerships. I hope many of you feel the same way. So thanks to you again, to all of you for you're just spending your time and giving such careful thought to such a critically important issue. Again, I just want to remind those of us who are in the audience to continue your conversations online. Use your hashtags, the SDH 2020-21. Also, I want to mention very briefly that we are going to have a survey, a very brief survey that we'll send you after this is over. And we hope that you'll take the time to complete it because it really helps us in planning for the future and making sure we're responsive to your needs. Also, if you saw someone or heard something that really sparked an idea for future networking and you don't know how to reach someone, please feel free to reach out to us by email. Subscribe to our newsletter. And then also we're going to be continuing our conversation over the next couple of days, focusing on the intersections of food and health and housing and health. So be sure to register for the next couple of days if you'd like to join us for that. So with that, again, I just want to say thank you to everyone. I also want to mention that, UHI is committed to these educational partnerships to advance health. We've actually, as Provost Kumar mentioned, our strong focus on our Bunting neighborhood leaders. These are our young leaders who are very actively engaged in the community. That's one of our signature programs, and we continue to support them throughout their life course. And many of them have actually been involved in educational partnerships to advance health equity. So we want to raise them up and just sort of thank them for the work they're doing. And with that, I'm going to say thank you and look forward to seeing you again soon.